Cameroon counts about 6,000 health centers in 200 health districts across the country, with more than half privately owned. But the bone of contention is that 1 out of 2 private health centers are either clandestine or irregular.
1 out of 2 private hospitals or clinics are clandestine or irregular, meaning they are illegal or below standard. This is coming directly from CRO-TV. A report found out by who? By the Ministry of Public Health. And what have they done about this? Nothing. And that is why in many of my videos, I told you people that what? The government of Cameroon has corrupted corruption. And for you to understand corruption in Cameroon, you have to think and reason above the normal corruption that we know. That is takes under the grace of God for somebody to identify an act of corruption in Cameroon. They are saying it and telling to the Cameroonians about this as if they have done something for the betterment of the people of Cameroon. No. Finding out, identifying illegal hospitals and clinics, irregular hospitals, is of no use to Cameroonians, but taking actions in order to stop them, because all these irregular hospitals and clinics or health institutions in Cameroon are killing thousands of people every year, killing them indirectly every year. Yet the government of Cameroon, all they can do is finding out and identifying them and waiting in their offices so that they will come with bribe and pay them to cover up so that they will keep on operating and killing many.
Hello and welcome to TFA Analysis. Please subscribe to our channel. Thank you very much.
Counts about 6,000 health centers in 200 health districts across the country, with more than half privately owned. But the bone of contention is that 1 out of 2 private health centers are either clandestine or irregular. Yoti Kaleli Songe has been probing into health care delivery in Cameroon and reports that a major challenge in 2023 will be to rid the sector of charlatans in scrubs and lab coats.
All roads lead to Rome, but not in this case. The healthcare is questionable in an environment that leaves some baffled.
The population feels they are cheap, but you see, clandestine hospitals have a lot of problems. Maybe hygienic conditions are not okay. It will bring more deaths and even make some of the diseases resistant to treatment, because their treatment will not be what it's supposed to be.
If 1 out of 2 private clinics across the nation's 200 health districts is not clandestine, it is irregular, as per statistics from the Ministry of Public Health.
They are all identified by the health district, and this is actually what will be, one of the main concerns of the ministry and the Minister of Health himself.
Keeping an eye out for the quality of care delivered in health centers is how the state intends to proceed.
To conduct on a regular basis an assessment of practices in such a way that prevention actions can be undertaken, at the same time that sensitization of the population, but also sensitization of those who actually open those centers. And on top of that, a law enforcement with sanctions should continue for those who jeopardize the health of our population.
This to make room for professionals to exercise their duty, lest the walls collapse in the same place certain individuals go calling for medical aid.
There is an acute shortage.
Any actions being done. What I was waiting to hear from the director is that they have closed down all those hospitals, all those clandestine or irregular hospitals from operating. But he says that what? They have identified them and action will be taken. And that is where I'm coming in. Many people will hear this report and say, no, Cameroon is fighting corruption. And that is those people who will reason and end at the level of normal corruption without thinking that Cameroon government has corrupted corruption. They have to think above corruption before they can identify this. When this kind of report will go to the World Health Organization, they say, no, Cameroon is doing well. They have identified them. What have they done? Comes after 50 years, all these reports will still be there. all those hospitals, clandestine hospitals, will still be there. Cameroon is more than 60 years old as an independent country. Yet, all these things have been happening. Many of these private hospitals in Cameroon are owned by people who are not doctors. They don't know anything as medication is concerned. They don't know anything in the medical field. They don't. They only have their money. And somebody advised them to open a hospital. And they open it and recruit anybody there. And they are working. A cleaner can be cleaning in their place for 2 years. And they say he's used to. And they just recruit him or her as a nurse. And that is perfect. And after working there as a nurse, he can become a doctor in Cameroon. Because it is business. TFA Talking Point is here just to talk about those two, clandestine and irregular. That in a country governed by the government that can take actions, the government that can do anything, elected by the people to help them, can only stand popularly and say that they have identified more than 1,000 health centers that are irregular or clandestine. And I'm here to talk about those two, clandestine and irregular. Clandestine here are a hospital that are illegal, unauthorized, meaning that government don't know anything about those health centers. The people just got up one day and decided that they want to become a doctor or they want to open their own hospital without informing the government. And then the government don't even know who are those working there. Where are the doctors coming from? What are the kind of equipment they are using? This is what they call clandestine hospital or irregular or illegal hospital. The government don't know. These are just businessmen who, after having their money, decided that, what can I do? Which kind of business can I invest in? Somebody say, okay, invest in health sector. And then the hospital person just got up one day and rented a small place. And then opened and called people. Maybe buy some few drugs and then just pick anybody around and say, come and be a doctor. Or go to where people who are selling roadside drugs and say, come to my place and be a doctor or a nurse. And that is how they started. And they are treating people, indirectly killing people. They are not treating anybody there because they know nothing about it. They are clandestine. They have not been authorized. And then the government of Cameroon, what they can do after identification is only identification. They end at identification and waiting in their own offices. So that all these unauthorized hospitals, it should come to them and say, we want to be authorized. What have they done? Where are the doctors coming from? What are the equipment they are using? The government refused. They have not gone into it. And it has been going on in Cameroon for more than 60 years today, since Cameroon got independence. And if you are in a city or anywhere in Cameroon, you will discover that you cannot move 10 meters or 20 meters away without seeing a place, a clinic or a hospital owned by somebody. That you grew with a person and know that the person have never gone to any medical school. Or you see somebody that you graduated from primary school together with. The person dropped out of school and then suddenly went to any place. And one day started saying that he is a doctor. And then from there, he opened his own clinic and his own hospital. We know all such people. Some of them have never gone to school even. They just grew up and their father was maybe selling drugs at the roadside. And then they grew up with the father for more than this year. They took over from the father and they have been selling drugs at the roadside. And then because they gained money, they have profit from there. They just open a clinic and recruit any kind of person. And the doctor allowed, and the whole government allowed them and called them unauthorized, clandestine. And then they are there, operation, it opened and doing the business, killing people. And the government, all they can do is move in there and say, where are your authorization? And then there is nothing to show up. And then you just took record the name of the place and you go back and say you have identified one unauthorized hospital. And then you are proud as a government director of Department of Health organization in Cameroon to stand and say that you people have identified. It is a shame to the government of Cameroon, to the healthcare system. Do you know how many people are dying every day because of this clandestine hospital? Do you know how many people? Many thousands of people. If one clandestine hospital is killing only one person a day, frustrating the lives of giving wrong medication and wrong prescription to one person a day. How many people are being killed every day? 1,500 people every day because of this kind of hospital, clandestine hospital. The hospital that the whole government don't know how it became in existence. It came into existence. A hospital where the government don't know who is working there. Whether the person working there is a doctor or a native doctor, or is a graduate from medical school or not. No, or is a teacher. And we are seeing teachers becoming doctors overnight. We are seeing drivers becoming doctors overnight. We are seeing frustrated citizens of Cameroon because they don't know anywhere to go and what to do, anything. They just go to the village and sell a plot of land, come to the city and ask, what can I do as a business? And somebody say, involve yourself in the healthcare system. And the person open a hospital. And then it becomes, and people in around the quarter is calling the person doc, and that is all. And they are moving around, prowling themselves and killing people, calling themselves doctor. And the government is there, ending at the level of identification and waiting for them with their money to come and bribe them. It is terrible. Another point that they make mention of it there is that irregular hospital, meaning hospital below standard. Hospital below standard, healthcare system below standard. This one is not only private. All together plus government hospital are irregular, below standard. All. You see, go to Lakendine Hospital in Douala. People are lying on the floor. That is not. That is below standard. You go to the hospital where doctors are not there. That is below standard. You go to the hospital where you have to pay as a patient for somebody to bring the doctor to take care of you. It is below standard. A hospital where government officials are afraid to go there for treatment, meaning the hospital is below standard. All hospitals, if they talk about there are 6,000 health centers in more than 200 health districts in Cameroon, meaning all these 6,000, including missions hospital, including private hospital, including government hospital, health center, are all irregular. All. If you read what I wrote in my book, Let's Change Our Mentality for a Better Cameroon, you discover in the domain of health sector, I talk about what is happening, the manipulation, the kind of corruption that is existing. That is why the government of Cameroon cannot stop roadside drugs, because top government officials are involved in it. They are involved in it. Irregular hospital, irregular health center, all over Cameroon, all, even the general hospital, they are irregular. They are below standard. The doctors there are below standard, below expectation. Because many of them went to quiz through corruption. And their main aim in the medical field is to balance what they used in order to join the medical field. And that alone can only be achieved through corruption. And that is what is happening. Hospitals without equipment is irregular. That is very common within the government hospital, not to talk of private hospital. Private hospitals are even the worst. Anybody at any time, there are people having a clinic, health center in their own house. The wife is there, the children are there, and all the family members are there with patients together in the room. Hospitals do not. When the government says this is the budget for this equipment, they go to the market, like Marché de Pont in Douala, they buy their medication there and come and be selling in the hospital. Government hospital midwives, they are buying drugs at the roadside to sell to delivering women at night. Doctors are buying drugs at the roadside and selling to patients at night. They destroy all equipment in the hospital and referring patients to their own private clinic. It is terrible. If we want to talk about the healthcare system in Cameroon, it is terrible. I'm going to take you one example that happened particularly to me. In 2014, I went with somebody to a clinic in Douala. She was having a filariae. And when we arrived at the clinic, we saw a nurse there. It was at night. And what she told us, she gave a medication, she told us that it's filaria. Yes, she was right. And then she gave up Mitizan, if you know what they call Mitizan. They treat filaria with. And then she wrote on a piece of paper that she should take 2 in the morning, 2 in the afternoon, and 2 at night. And then I asked her, what are you talking about? She said that is a prescription. I have worked with the healthcare system in Bambala, Ndobungokitunja division. I work with it because my father was a health committee. And then when they were looking for volunteers during holidays, I participated to distribute Mitizan for filaria in the village, and in which you have to take 1 tablet after 6 months. This lady gave to us to take 2 in the morning, 2 in the afternoon, and 2 in the evening. And the person I went to the hospital with was a nurse, and she asked, "What are you doing here?" We requested to see the person who owned that place. And I'm not going to give detail about this, but we did something about it. That is what happened. If we were not aware of it, she could have taken this, and that could have been the end of her life. That could have been the end of her life. Or she could have been paralyzed if she would be alive. That could have been the end of her life. And this is what thousands of Cameroonians are going through every blessed day in the hands of irregular hospitals, in the hands of a clandestine clinic or hospitals in Cameroon. And the government of Cameroon is aware of it because it is a big business for them. It is a big business. They are the ones selling all the irregular equipment, all the roadside drugs. They are the ones supplying the top government officials, together with the custom and the police. They stand openly and say they are fighting roadside drugs. And they are showing on TV how they are burning some, only for those who refuse to pay the money. If they claim that they are fighting it, they should go to the market. They have constructed market for such thing. And the people are selling roadside drugs. They're supplying to all those who are selling at around the quarter. That marché de pont. There is a whole market constructed by the government, and they are taking tax every month from those people there. They are selling what? Roadside drugs. And the government is moving and destroying a cure from people around the quarter because they refuse to give them money. Why? The source is there. It is terrible, and we have to take care of the healthcare system. Thousands of Cameroonians are going into their early grave every day because of irregular hospital, because of a clandestine clinic and a health center in Cameroon. And all the government of Cameroon can say is identification. And then at the level of identification, we should stop.